Acute Respiratory Distress Syndrome, ARDS 1. Understanding the pathophysiology of ARDS. 1. Key concept. A severe inflammatory process that causes widespread lung injury, leading to acute respiratory failure, hypoxemia, and increased permeability of the alveolar capillary membrane. 2. Simplified explanation. Think of ARDS as lung inflammation gone wild. 2. The lungs become severely inflamed and damaged, leading to fluid buildup and difficulty in getting oxygen into the blood. 3. Mnemonic, alien. For key aspects of ARDS, acute onset, lung injury is diffuse, inflammatory process, edema, pulmonary, non-cardiac in nature. 4. Key features. Diffuse alveolar damage, DAD. Widespread damage to the alveolar and capillary membranes, causing increased permeability and fluid leakage into the alveoli. Inflammation, a major role due to cytokines and inflammatory mediators that contribute to the damage. Non-cardiogenic pulmonary. Edema, fluid accumulation in the lungs due to increased permeability of the capillaries, not from heart failure, that impairs gas exchange. Hypoxemia, severely reduced oxygen levels in the blood. Reduced lung compliance, stiffening of the lungs, making it difficult for them to expand properly. Increased alveolar dead space. 5. Main causes, triggers. Sepsis, severe systemic infection. Pneumonia, severe lung infection. Aspiration, inhalation of gastric contents, water, or other substances. Trauma, severe chest or head injuries. Pancreatitis, severe inflammation of the pancreas. Toxic inhalation, exposure to chemicals, smoke, or other toxins. Blood transfusions or reactions. 2. Clinical manifestations of ARDS. Once a key idea, symptoms develop rapidly and are usually severe, often requiring intensive care. 2. Mnemonic for ARDS symptoms. Rapid onset of respiratory distress, agitation or confusion. Profound dyspnea, severe shortness of breath. Increased respiratory rate, tachypnea, and work of breathing. Decreased oxygen levels, hypoxemia, often not responsive to supplemental oxygen. 3. Additional symptoms. Cyanosis, bluish discoloration of the skin due to low oxygen. Use of accessory muscles for breathing, neck muscles, abdominal muscles. Crackles or diminished breath sounds on auscultation of the lungs. Cough. Multi-organ failure. Fatigue. Low blood pressure, hypotension. 3. Diagnosis of ARDS. 1. Key idea. Diagnosis is based on clinical criteria, imaging, and exclusion of other conditions. 2. Mnemonic for diagnosis, CRAP. Clinical criteria, such as acute onset, predisposing factors, and severe hypoxemia. Respiratory symptoms and assessment. Evaluate for symptoms such as severe dyspnea, tachypnea, and cyanosis. Alveolar damage, diffuse on imaging studies. Pulmonary imaging studies, chest X-ray or CT scan, shows bilateral infiltrates, opacities, that are widespread and diffuse and are not due to heart failure. 3. Additional tests. Arterial blood gas, ABG. To assess oxygen levels, CO2 levels, and pH, it often shows severe hypoxemia that is resistant to supplemental oxygen and respiratory acidosis. Rule out other conditions, such as cardiogenic pulmonary edema and other causes of hypoxemia. 4. Management of ARDS. 1. Key idea. Treatment is supportive and aimed at maintaining oxygenation and addressing the underlying cause. 2. Mnemonic for management. Protect. Protective lung ventilation, using low tidal volumes and high positive end expiratory pressure, PEEP, to improve oxygenation and minimize lung injury. Recognize and treat underlying cause of ARDS. Oxygenation, supplemental. Providing supplemental oxygen to correct hypoxia. Tight fluid management, preventing fluid overload while maintaining adequate intravascular volume. Evaluation of respiratory status. Continuous monitoring of patient status. Corticosteroids may be considered in specific cases. Treatment of complications and multi-organ system support. 3. Additional treatments. Prone positioning, placing the patient face down to improve ventilation and oxygenation. Neuromuscular blockers, to improve ventilation. Extracorporeal membrane oxygenation, ECMO, to improve oxygenation if the above measures fail. Nutritional support, pulmonary hygiene, treat complications as they arise. Potential complications of ARDS. 1. Mnemonic, pills. Pneumothorax, air in the pleural space. Infections such as pneumonia, sepsis, and ventilator-associated infections, lung fibrosis, and chronic respiratory issues. Shock from systemic inflammation, low blood pressure, or multi-organ failure. 2. Additional complications: multi-organ failure, pulmonary embolism, deep venous thrombosis, long-term cognitive and psychological issues. Simplified explanation. 1. Severe lung damage. An underlying condition triggers severe inflammation and damage to the lung tissue. 2. Fluid buildup. The lung air sacs, alveoli, become filled with fluid due to increased permeability, and the ability of the lungs to transfer oxygen to the blood is impaired. 3. Breathing becomes difficult. Severe shortness of breath and low oxygen levels develop, and breathing becomes ineffective due to poor lung expansion. 4. Life-threatening. ARDS is a medical emergency that requires intensive care and can be fatal. Professor Hammer's advice for learning ARDS. 1. Understand the diffuse damage. The main concept is that ARDS causes damage throughout the lungs. 2. Know the causes. Be aware of the major predisposing factors that can trigger ARDS. 3. Recognize the symptoms. Recognize the signs of rapid onset respiratory distress and severe hypoxemia. 4. Think supportive care. Treatment focuses on improving oxygenation and treating the underlying cause. 5. Complications. Be aware of the many serious complications associated with ARDS. In summary, acute respiratory distress syndrome, ARDS, is a serious and often life-threatening condition that is characterized by severe diffuse lung injury, increased alveolar permeability, impaired gas exchange, and profound hypoxemia. Recognizing the clinical presentation and managing the condition properly with supportive care, and addressing the underlying causes of the condition are critical for managing patients with ARDS.